I'm Jill Oliver. I'm a licensed sales agent in the state of South Carolina with Humana. So this is my 10th year with the company, and actually Humana is celebrating their 60th year in business. So we're proud to say we've been in the United States serving members for 60 years. This is not a sales presentation. This is, as we said, Medicare 101. So I'm here to help you understand and navigate some of general questions about Medicare. And then if you guys have any questions at the end, I'll be glad to take and answer any of those questions for us at the end. So please table those till we get to the end, and we'll go through just some general questions. We're going to talk about original Medicare, Medicare supplements, as well as the Medicare Advantage plans. So I thank y'all for your participation. I hope everybody enjoyed the lunch today. Chick-fil-A is always a good one, and I hope that might have been something different for everybody, and hope you enjoyed it. So thank you again. So again, I'm Jill Oliver. I'm local. I'm from the Irmo area. So I live here, work in this area, but I can serve the entire state of South Carolina. Everything in the Medicare world, and this is a blanket statement for all individuals, it's all about the state that you reside in, as well as the county. So plans are drawn up by insurance companies based on the state for that plan, as well as the county. And what's going to grow that population of plans are providers, doctors, hospitals that sign contract with that plan, as well as members, people that join that membership. So all of that sort of goes hand in hand, and whatever insurance company you are with for your Medicare supplement or advantage or drug plan, we all have to abide by Medicare rules. So we have to at least give you the Medicare standard, if not more. Our objective is to give you more. So again, thank you. I'm Humana. In my world, we say 'tis the season. This is open enrollment, or AEP. How many people are getting things in the mail left and right, seeing the commercials? One thing a lot of my members are getting, and I will say this just as a precautionary tale, Medicare is not going to call you. The US government doesn't call you. They're going to send you a letter, just like those commercials with the IRS. IRS is going to mail you something. Medicare doesn't call you. So be careful with folks that are calling, and be careful giving out your information. If they're identifying themselves as Medicare, that is not true. Medicare is only going to send you a letter. They are an actual licensed agent for a company that's selling some type of insurance policy. So just do good diligence for yourself. That be wary of giving out information unless it's somebody you specifically want to talk to, because there are the unfortunate incidences of people that are trying to get info for you. So be careful on that. So Humana cares and listens first, then delivers the care that speaks to you. No two people are alike, and the care that's best for your good friend or your neighbor down the street may not be right for you. Humana cares goes beyond what's expected to help you find the care that recognizes what matters most to you. It's about being there with every step of with you every way, and giving you the confidence for the right plan. So what we mean by that is Medicare is individually based. You might be a couple in the same household, but one person may need one plan and the other person may need something different based on your health needs, economic needs, or so forth. So none of the plans are joint or couple based or household based. It's all based on that individual, whether that be original Medicare, a supplement, or a Medicare Advantage plan. Everything is individually based. Caring for everything that makes you you. So today we're going to cover Medicare eligibility. What that is when you become eligible for Medicare, you are either turning age 65, so that's when that red, white, and blue card shows up about 3 to 6 months prior to your 65th birthday. That's when you really get inundated. You're on a national mailing list, so everybody's sending you something. The other way of becoming Medicare eligible is if you've become disabled. Say you're under the age of 65 and Lord forbid you became injured or hurt and you're on disability, then start collecting your Social Security benefits. After the 2-year mark of becoming disabled, you're becoming eligible for Medicare. So I do have folks that are under the age of 65 that are Medicare eligibility, but it's based on disability. So either turning 65 or becoming disabled make you eligible for Medicare. What is Medicare? So Medicare is that red, white, and blue card. It has parts A and B. A is going to be your hospitalization. That's going to pay at 80%. And then you're responsible for the 20% that Medicare does not pay, as well as the deductible that Medicare charges. Medicare also furnishes to you Part B. That's your doctors, your outpatient surgery, your labs. It too pays at 80%, but you're responsible for 20. So Medicare helps you with hospital Part A and doctor Part B. What Medicare does not do is give you D, the prescription drug plan. You've either got to go out and purchase that on your own, buy it within an Advantage plan, or if I have individuals that are veterans that may be taking it through the VA, or maybe you or a family member are with TRICARE, that's the family insurance for military family members, that has the prescription in there. Or in some cases I have where maybe a former employer is offering the prescription through them. That's called qualified health insurance, because that group insurance is covering you there. Medicare options, we've lightly touched on that. You can go straight original Medicare by itself, where you're paying that deductible and that 20%. You can buy a Medicare supplement, or another term for that are called Medigap policies. Those are the plan Fs, the Gs, the Ns. All insurance companies have the same book of plans as far as benefits on that. We may just not all offer, say, a plan G or a plan N, but we all have to offer the same core benefits within the supplements. Pricing may vary from company to company based on age. With the supplements, we're also looking at a health questionnaire. Have you been in the hospital? Are you under the treatment of a doctor for certain health conditions? So just like a life insurance policy where you're asking answering a health questionnaire, same thing is applicable on a Medicare supplement, that you've got to go through some health questions to determine if that insurance company is going to be able to underwrite that policy for you. So then the next option would be a Medicare Advantage plan. That has Part A, hospital, Part B, doctor's outpatient surgery, and then D, the drug plan. So just like an old school math problem, if we take Part A, Part B plus Part D, you loosely in the Medicare world may hear that called Medicare C, or all-in-one plans or Advantage plans. Those are all the same thing. Might be close to what you had in your working years. Y'all might have had a PPO when you were working, or an HMO. Those are the type of plans in those Advantage plans. That's where you take the benefits and you bundle it all into one package. Next option would be to just do straight out Medicare drug plan by itself, the PDP or prescription drug plan. Important dates. We're right now in one of the important times of the year that we're seeing in the newspapers, on the radio, on the news. October 1st to October 14th in my world is called pre-AEP, pre-annual election period. So from the 1st to the 14th, insurance agents can talk to you about plans, your current plan, potential new plans for you. If you are speaking with an agent, they can go over information, they can do an application, but we cannot actually take possession of the application and send it to Medicare. Medicare rule is you've got to hold on to that paper application till the 15th, then you can physically mail it in. Then from the 15th through December 7th, it's wide open enrollment, AEP, annual election period. You can sign up with as many companies as you want from October 1st through the 7th of December. Whoever the last person that you have that Medicare receives on December 7th, that's who you're going to roll into that next calendar year with. So you can see whomever, you might say, hey, I'm happy with what I got. It should roll into next year for you, unless your insurance company says, we're doing away with that plan. You need to talk to an agent about a new one. So if you like the plan that you have, most companies allow you to renew it into next year. If you want to make changes, now is the time to be thinking about that, to make changes. After December 7th, the window closes. On January 1 to March 7th, then you're going to have another election period called OEP, open election period, that if you maybe made a change from October 1 to December 7th, got into it in January, and then about mid-January, February, like, I don't think this is what I want to be in. You have that one opportunity to make a change during that period. After that, you're locked in, can't make a change again till open enrollment, unless, here comes the but, or the unless, certain circumstances, we call it SEP, special election period. So those circumstances are going to be maybe you moved from one county to another, that opens the window to make a change. If you move from one state to the other, that's a 60-day window to make a change. If you're getting some type of special help, such as Medicaid, if you get extra help from the government, that's an opportunity to make a change as well during the year. Or there's another type of help called LIS, low income supplement or prescription drug help. Both of those, the LIS and the Medicaid, those are income asset dependent type help. It's out there. That's LIS, the drug help, is through Social Security. And then the Medicaid is through the state. In the state of South Carolina, we call it Healthy Connections. Those two are types of help that the government helps you, and those warrant election periods for you outside of the October 1 to December 7th. So just know you're not stuck. Always talk to somebody, a licensed agent, or possibly Medicare if you feel something's going in. So right now, you got till December 7th to make any changes that you want. That window is going to close. And then another one will open up October to March to determine if you might have made a mistake or didn't get into something you really wanted. You got one more opportunity to change, and then you're done for the year. So choosing a plan or more, again, that's just important. All of this, what I tell my folks when I'm sitting down with somebody is it's about need, it's about budget. It's about what's best for you, not what's best for Jill, what's best for Humana. It's best for you, sitting down, talking it out, and making sure we're hearing everything you're looking for, you're needing, and it's fitting into that budget. We lightly talked about a second ago, doctors, making sure those doctors and providers you want to go to are in that network. That's the worst thing in the world, is get this new shiny insurance card and you get there and the doctor says, oh, I don't take that. So you want to make sure all those things are in place before you make changes, for sure. All right, so are you eligible for Medicare? If you are within 3 months of turning 65, so in my world, I say that's a teenager. So if you're within 3 months of turning 65, you are eligible for the Medicare initial enrollment period. If you are under 65 and have a qualifying disability or the other chronic disease that is a qualifier is ESRD, end-stage renal disease, you're in kidney failure, needing a transplant and doing dialysis, that's also a Medicare qualifier that you're eligible for, the red, white, and blue. So anything that I sell as a Humana agent or any other insurance agent selling a Medicare related product, you've got to have parts A and B. That's crucial. So what is Medicare? We talked about original Medicare, that's parts A and B. Remember, A, you attain when you turn 65. Not everybody retires at age 65. My mom was a school teacher in the state of Georgia. She worked to age 69. So she deferred her B benefit till she retired. A, you automatically get. Most individuals with Part A, they're not paying a premium on A because during your working years, you had taxes coming out of your check that goes towards your Medicare Part A. Or you might have had a spouse, maybe you didn't work, but the spouse did, and you're drawing on their Social Security benefits, then most folks are not paying an A premium that taxes were taken out of their check. Some do if they didn't have enough credits in the system. Medicare and Social Security will alert you what your premium that is due monthly based on that. The other situation is if your income is above certain annual tax limits, then Medicare may hit you for a higher premium because you're over a certain income limit that you're having to pay more on a premium. So Part A, generally speaking, most people don't pay a Part A premium that the taxes were taken out of their check to pay that A. That happens at age 65, generally for most everybody. B, you can defer Part B. So B, you don't have to turn that on till you're ready to start drawing it. Everybody is billed a Part B premium. So in the state, or right now in the US, the national average for Part B is $148.50. Social Security is taking that out of your check automatically. If you are drawing Social Security and you have Medicare, it's going to be an auto deduct coming straight out of that Social Security check before the money goes in the bank or before you get your check. Now, some folks don't pay the Part B themselves because they're getting that extra help, Medicaid or some type of government assistance based on possibly a chronic condition or maybe an income asset that they might be under the poverty line, so they're getting extra help. But everybody is billed for Part B. So the starting base in Medicare is going to be Part A, generally not having to pay a premium for A. Part B, everybody has a premium. Most people are paying that, but some folks do get help. So that's your base. That's going to pay at 80%. Everything above that is going to be a 20% cost to you, plus a Medicare deductible of $1,483 on Part A. And then on Part B, it's $203. Then you can build upon that and do Medicare Part C. That's those all-in-one, the Advantage plans, where it has Part A, hospitalization, Part B, doctor's outpatient surgery, labs, and then D, drawn together, A plus B plus D equals C. Those are probably the ones you're seeing most commonly on TV right now with the Kid Dynamite, JJ, or Joe Namath, or I think there's I always say the wrong one. It's not Joe Theismann, it's Joe Montana, I think. So, and then we've got, Humana's got our commercials. We all got our commercials out there. That's what you're probably seeing the most of on TV. Those are bundled. You're picking up a lot of extra benefits. One thing Medicare does not cover is your teeth. So in those Advantage plans, a lot of them are either building them in as an extra benefit or you can buy it on top. Also, in some of those, we've got some transportation. There's Silver Sneakers. That's one of my favorites. That's the fitness program that you can go to various gyms within the community. Also, there's some vision in there, some hearing aids. So these are extra things that that insurance company is bundling into that plan for you, generally speaking, at no additional cost. Then the third option is Part D by itself. So you can have Medicare A and B over here. And then, because remember I said Medicare doesn't give you the drug plan. You've got to come over here and buy it separately, or you can take the drug plan Part D within that Advantage plan. So a couple options: original Medicare by itself. You can do a supplement. You can do a Medicare Advantage plan, or you can do Part D by itself, any of the above. Special needs plans. So special needs plans are if you have original Medicare and at least one of the following: a specific eligible chronic condition such as diabetes, heart disease, or a chronic lung disorder, Medicaid assistance from the state. Remember I said in the state of South Carolina, we call it Healthy Connections. It's a blue and white card. A need or an expectation of needing care in a long-term care, nursing or skilled nursing facility, an intermediate care facility for people with intellectual disabilities, or an inpatient psychiatric facility for at least 90 days. You may enroll in a Medicare, we call it a SNP, a special needs plan, that offers you focused benefits to meet specific needs. So in the Medicare world, most insurance companies have recognized, again, it's not all chocolate and vanilla. We've got to have some options for folks because not everybody has the same thing going on. So most insurance companies are now started offering the special needs plans. And we also offer called a dual eligible special needs, meaning you got Medicare, Medicaid. So you're getting extra benefits, generally speaking, at a better, lower, and in sometimes zero type cost. On the chronic plans, we're identifying this person has some type of chronic condition going on, diabetes, heart disease. So we may tailor craft a insurance product for those individuals to help them with possibly co-pays at the specialist. Because obviously if you're diabetic or heart disease or COPD, you're going and seeing a specialist probably 1, 2, 3, 4 times a month. So these are designed to help you with the cost of that health care. Those are called special needs plans. But to enroll in one of those, you've got to meet that special criteria. You either got one of those chronic conditions going on, or you've got that extra help such as Medicaid or prescription drug help. A Medicare supplement plan, these are also called Medigap plans. So if somebody says, I've got a supplement plan, or I've got a Medigap plan, or here's one that rings true. My neighbor went to the hospital and they had open heart surgery and they didn't pay anything. So more than likely, that tells me if I hear that, that person's more than likely probably got a supplement, or either they're on Medicaid. Or if they say, I got a plan F, I got a plan G, those are supplements. Medicare pays the first 80%, and then the supplement you bought with that insurance company, it's going to pick up potentially that full 20% or the majority of that cost. We're on table to the end, if we may. So hold that thought. Write it down if you need to, excuse me. So with a supplement, remember I told you in the beginning that you always are billed Part B. So when you buy a supplement, you are purchasing a insurance policy on top of your Medicare. It's going to come at a cost. Supplements are based on the state you live in, the county you live in. Then it boils down to male, female. Then it's going to be smoker, non-smoker. So those are factors that goes into determining your rate. Then it boils down to, a few minutes ago, I mentioned that health questionnaire. Have you been in the hospital? Are you under the treatment of a doctor? What medicines are you taking? So just like in the financial world, we have a credit bureau for all of our credit transactions. In the insurance medical world, there's a medical bureau that anything that your doctor has prescribed to you or treated you for, that's going to go into that medical bureau. It's called an MBI, Medical Bureau of Information. So when an insurance company is pulling info for that supplement, they're going to pull that medical bureau to determine can they or will they be able to underwrite that policy for you, and it is at a stated cost, or would it be higher or lower based on what that returns? So supplements are good, they pay the most, but it is an upfront monthly premium that you're paying every month for the benefit of that health care in addition to your Medicare. With a supplement, again, that works on top of your Medicare. You're not limited to a provider network. So Marty was asking me about managed care and networks. So with a supplement, you can go to any provider in the United States, as well as District of Columbia and Puerto Rico, that accepts Medicare. So the rule with that is, if that hospital, that doctor, that urgent care, that whomever, if they take Medicare, they have to take your Medicare supplement policy. No matter if it's an F, if it's a G, if it's an N, whatever that Medicare supplement is, if they accept Medicare, they have to take that. So you are not limited to a network of doctors. Also, some people like the supplement because if you travel, especially internationally, there is coverage to get you back stateside with that Medicare supplements. Supplements are great. I will say that most companies do increase their cost on your anniversary. And most of them, it's not, they're going to say, I'm not going to pick on you, Bill. They're not going to say, hey, I'm going to give Bill an increase, but I'm not going to come over here and give, just because I know Joanne in the back, I'm not going to give Joanne an increase. When a company decides to do an increase on their supplements, they do it across the board for everybody. It just might hit Bill in July when he bought his policy, but Joanne might not have bought hers until April. So you'll feel that increase when you come up for your anniversary. They run on a calendar year, but if you do get an increase, you're going to see it when your anniversary of buying that policy was. Sometimes they don't increase. It's not a given that they don't, but typically in the case of Humana, we're usually about a 2 to 4% increase. And if we do it, it's across the board for everybody. You're going to see it when you come up with your anniversary. So that is your supplements. And some give you extra benefits, like in the case of Humana, that's all I sell, so I can only reference that. We give you the core benefits of that supplement. Something we do on top of that is we do the Silver Sneakers gym membership. We feel that's important. It's good fellowship, it's good health. So that is an added that we throw in there at no additional cost to you, but we have to give you the same F benefit that a Blue Cross does, that a Aetna does, that a Mutual Omaha. So we all have the same core benefits. We just might give you some extra stuff in there. We talked about Medicare Parts A and B. That's original Medicare. Part A helps cover inpatient care. So you have been admitted into the hospital as an inpatient care, like overnight hospital stays, skilled nursing facility care, hospice care, and home health care. Part B helps cover doctor's visits. That's going to be your primary physician, whether that's a general doctor, family doctor, or an internist. We all consider that the same thing, a primary care. Then when you go over to a specialist, the orthopedist, the cardiologist, those are all going to be on the specialty side. Durable medical equipment, that's like diabetic shoes, oxygen tanks, wheelchair, beds, all of that is, we abbreviate it, called DME. Home health care and some preventive services. So the one thing that everybody gets at no cost just by having the red, white, and blue is everybody gets their annual physical. For the ladies, it's the mammogram, the pelvic, the pap. For the gentlemen, it's the prostate, the general overall health check. We have our ears checked to determine if you need hearing aids. Medicare does not pay for hearing aids. They're going to tell you you need them. You either need to look to your plan, whether it be a supplement or an advantage plan, to see if there's some discounted costs with that. For my veterans who use the VA, I say go to the VA. You worked hard and fought for our country. That's a benefit the VA does give you at no cost. Medicare will give you an eye screening to determine, do you have glaucoma, macular degenerative, or cataracts? In those cases, those are diseases of the eye. Medicare does cover those at no additional cost. But for somebody like me that needs general upkeep of the eyes, that Medicare does not cover. So in my supplements, we give you some discounted wholesale discounts through a company called iMed Express. On my Advantage plans, we've built in some vision at no additional cost. So those are some things to look at. One big one that a lot of people are inquiring about, you do get the flu shot at no cost. You do get the pneumonia shot at no cost. What is not covered that we're seeing on the TV is shingles. Have y'all seen that commercial? Say, what? Shingles? So that is not covered by Medicare as a no-cost benefit, but it is covered under your Part D as a prescription drug benefit. You would have a copay in that, but it is not a no-cost like the flu shot, like the pneumonia shot, as of now. Hopefully, fingers crossed, one day that will catch up with Medicare, but at this point, that is not covered. Hold that thought, we'll come back. So that is parts A and B. So Medicare Part C, that is, remember, hospitalization, Part A. Part B, doctor's outpatient surgery labs. And then D, the drug plan. We roll it all together. It's called Medicare Advantage. I also have what are called Medicare Advantage only without the drug plan, where you can have A and B in there only. Who buys those a lot of times are going to be my veterans that might be going and getting their prescriptions at the VA, but they want to be able to come, what I call, to the civilian side to see a doctor over here that maybe they like better than what they're getting over here at the VA. So it's a happy blend of the two. It just doesn't have a prescription drug plan in it. So those are Medicare Advantage non-prescription drug plans. So I told you with the Part C, that's going to have, you're going to need to have Part A hospital, Part B doctor's outpatient surgery. I'm going to digress for 1 second. 2 years ago, everybody should have got new Medicare cards. Did everybody get new ones with a random set of letters and numbers on it? That was for your protection with identity theft so high these days. What Medicare did, it used to be your social with an A behind it or your spouse's with the D behind it. So because fraud is just so rampant these days, Medicare decided to give everybody its own individual Medicare number. So we all should have got new cards in the last 2 years reflecting that, especially last year. If you didn't, you can always call Medicare to get that replacement card. But that's what was going on as to why you got away from your social or your spouses and got those 11 digits of numbers and letters. So for any of my Medicare C plans, a requirement is Parts A and B. You may have to pay an additional monthly premium. So some plans by virtue of the insurance company or the county that that plan is offered in. In some cases, I have plans that do have a premium. Some might be $14, and I'm just throwing out some different ones. Some might be $81. Then I have a lot that are zero. So it's sitting down, looking at what county you reside in, what plan is going to give you the best return for value and benefit that you're looking for. So it's always important to look at what the premium is, what are the benefits, what are the copays, and then most importantly, are my doctors in that network? Are they going to be accepted? You may be able to purchase supplemental benefits like dental and vision. So I said on some of my plans, we have the dental and the vision built in at no additional cost. So these are dental plans. They're discounted, but it may in some cases not be as rich as what you had at your working job through group insurance, but it's still coverage to help you do some preventative things, as well as possibly help you with dentures, crowns, root canals, etc. On the vision, a lot of times that's helping you with lenses, glasses, frames, contacts as well. So in Medicare C, the bundled products that have the A hospital, the B doctor, and the D drug, we can drill that on down, and these would be plans similar to your working years. You've got a HMO, a health maintenance organization. In most cases, a primary provider arranges your health care within the plan's network. So an HMO is a great plan, but it is defined that you can only go to that network of doctors and providers. If you stepped out of that HMO network and decided, I need knee replacement, and I want to go over here to Jill's knee replacement company, who's not in the Humana HMO network, versus going over here to Lexington Orthopedic, then I'm going to end up paying all of that because I chose to go out of the HMO network. Had I gone over here to Lexington Orthopedic, who's in the network, I'm going to have a controlled cost because they've signed a contract. They will not charge the Humana members more than this amount. So the exception to that rule is emergency. That if I was in my yard and I'm a Humana HMO member and I fall and I break my leg and the ambulance has to come take me to the hospital or take me to the emergency room, and I'm out of the network, or let's say I'm over in California visiting family and I'm out of the South Carolina Humana network. Emergencies are the exception to that rule with any HMO Medicare insurance plan. So if it's a medical emergency, you can go to the nearest ER, urgent care, doctor's care, or hospital and get the care you needed and would not be refused because that's an emergency. You didn't choose to go out of the network. It's only when you say, I don't want to go there, I'm choosing to go there. So an emergency is an exception to the rule. The insurance will pay in that case. A PPO, that's a preferred provider organization. So that's a group of doctors that have chosen to accept Medicare and agree to build the plan, but you're going to get better costs by staying in the network. So we have some PPOs that let you go in the network of providers. It'll also let you go out of the network. So for instance, here in Columbia, I have a orthopedic group who is choosing not to be in my network. That's their business choice. They will see my members, but they're going to see them over here as out of network. When my members go there as an out of network patient, they're going to pay a higher cost than going over here to someone who's in the network. So you just need to be diligent when you're making those choices. Are they the best one for my health? Are they the best one for my budget? Making sure if you're seeing somebody new, they're in your insurance network. That's applicable with any insurance, and even myself who's not on Medicare. Like I said, I got hit with the kidney stone, but I was deep into it and I was in pain. So I was happy to feel better at that point. The last one is called a PFFS, a private fee for service. Generally, there's more freedom to choose providers, but network arrangements may still apply. So a private fee for service basically says those doctors don't have to be in that contract. They're willing to take it. They're just going to have to agree to bill that insurance company and you for anything above and beyond. So there are PFFs out there, PFFSs out there. Predominantly, it's more HMOs and PPOs. Those have come a long way as far as flexibility of provider and benefit. Private fee-for-service plans are not Medicare supplement insurance plans. Providers that do not contract with a PFFS plan are not required to see plan members in emergencies. So that's your exception to the rule there. Medicare Part D, that's prescription drug coverage, which is available as part of a Medicare Advantage plan. Remember, we've bundled everything in Advantage. The A plus the B plus the D equals C. Or you can have a standalone prescription drug plan. If a beneficiary enrolls in a Medicare Advantage plan without a prescription drug coverage, they also may enroll in a standalone prescription drug plan. So my company does not currently offer this. I know there's some other ones that in some cases may allow you to have an Advantage plan that doesn't have a drug plan in it, and then may come over here and let you buy the drug plan with it and combine the two as two separate sources of filing. Not a lot of those, you just have to seek that out, but that is a possibility. One thing that I definitely encourage folks, and some people have missed, is that let's say you're coming into Medicare and you're like, well, I'm not taking anything, or my medicines are so expensive. Why do I need a drug plan? So in the fine print, Medicare says when you start drawing Part B, if you do not take out D, the drug plan, in some form or fashion, buying it by itself or getting it in a Medicare Advantage plan, if you forego it when you start B, and then down the road say, well, gosh, now I'm taking some medicines, I think I do need that prescription drug plan, Medicare is going to penalize you for all of those months and years that you went without the prescription drug plan. A lot of people miss that. And so when they do change over to one that has the drug plan in it, then they get hit with a penalty that does not go away. You're charged that penalty monthly for the remainder that you have a prescription drug plan. So it's always important to remember to think about that. The exception to that rule is going to be my veterans, because they have a qualified drug benefit through the VA. Keyword is qualified, that Medicare is recognizing that it is a doable, qualified, quality prescription drug plan. The other exception would be if you had an employer that offered it through the work. That's called group insurance. That also is qualified as well. It has to be at least as good as what Medicare Advantage plans would give you, or a drug plan by itself. So a lot of folks get hit with that penalty and are not happy about it because they didn't realize it, or it wasn't in that small fine print of when they enroll. So something to be leery about, that even as Humana, we're having to collect that fee for Medicare as a penalty, and I can't make it go away. The only way to have it go away is if you were getting Medicaid, drug help, or you drop the drug plan. So important to always think about your prescriptions. So anybody heard of the donut hole or the coverage gap? Anybody's friends, family, or themselves said, oh my goodness, about middle of the year or towards the end of the year, my drug costs just exploded on me. I don't know what happened. So every year Medicare sets a benchmark that from $0, we run on a calendar year, January 1 to December 31st. Medicare says in the year 2020 that the coverage gap is going to start at $4,430.01. So once you've reached that stage in your cost of purchasing medicines, as well as the insurance company, because we're getting it for you at a wholesale price. So once you reach that $4,430.01 in 2022, you've gone into the gap or the donut hole. So what happens then is then you're going to pay roughly about 25% of the cost of that drug. You're no longer getting it at what the insurance company drug prices were offering, which could have been $0, $4, $12. You're going to pay 25% of that cost. Then once you reach $7,050, you're in the catastrophic stage. You're going to get Medicaid or low income type pricing, where it's going to be $3.95 to $9.95, depending upon the drug that you're taking, or possibly 5%. That would be more like a specialty type medicine. So once you hit the 7,050 to get out of the catastrophic, basically the calendar year ends, January 1 starts, and it goes to whatever Medicare sets that benchmark for that year. So the gap follows you if you started in one insurance plan and let's say March or February you change, but you're taking super expensive medicine and you're already in the gap within those first 2 months, which believe it or not, it could happen. And you decide to change to a different insurance company, that trail is going to follow you over. So it's not indicative to one company, it's how your prescription drugs ran through the year, if that makes sense. So how do you try and keep that as low as possible? Medicines are talking about 5 tiers of drugs, 1s and 2s, and this is applicable for all insurance. 1s and 2s are your generics. Those are the least inexpensive medicines. The patent has fallen off, meaning I go to Walmart and I want to buy Heinz ketchup, but then there's Equate right beside it. That's the Walmart brand. I might get a cheaper cost than buying the Equate versus the Heinz. I'm paying for the Heinz label on the ketchup versus the Equate. In some cases, and I'm not knocking these are just 2 off the top of my head, Xarelto, Eliquis, popular medicines a lot of people are taking right now. Those are fairly new to the market, so the patent hadn't fallen off. In my world, in Humana, those are what are called class 3 or tier 3 drugs. They're going to start lowering cost. In some of my plans, you might have a deductible you've got to meet before you get the lower cost on that drug. Standard Medicare deductible for all Part D plans in 2022 is going to be $480. So if there is a deductible on your plan, that's going to be the insurance company determining if they're putting a deductible on that Advantage plan or that straight drug plan. You'll meet the deductible and then it'll come down in price. So that is your Part D. So tier 3s are going to start the higher cost. Tier 4 is going to be a preferred name brand drug. Tier 5 is going to be your specialty, chemo, dialysis. And when I say chemo, that's physically getting a prescription and taking the chemo. If you're going to the oncologist's office, that's covered under your Part B. So specialty drugs are physically getting a prescription. Another thing I would mention that I do tell my members, when you're in those 3s, 4s, and 5s, you want to do due diligence for yourself. Use your drug plan's preferred pharmacies. So I have preferred pharmacies, I have standard pharmacies. In Humana world, my preferred pharmacies, these are folks that we've done business with, wrote contract with, Walmart, Walgreens, CVS. You can go over here to Food Line, you can go over here to Publix. You're still going to get your medicines covered. You might just get a better deal going over here to these preferred, because they've signed a contract to give a better wholesale price preferred to my members. The ultimate, most inexpensive, more affordable, in the case of Humana, we own our own pharmacy. It's called Humana Pharmacy. So because it's not a retail storefront, we can control that pricing and give a better discount on that. It's weighing out. It is mail order. Some people like mail order, some people don't. It's a personal preference. So in my case, the ultimate best discount you're going to get is Humana Pharmacy, but you may not want to get your medicines through mail order. You might prefer to go this route here. So to keep yourself pushing the coverage gap out as far as possible, to not happen at all or as low as possible, do due diligence for yourself. Shop around who's going to give you the best price on that medicine, because Walmart might have it at one price and the CVS might have it at another. And it could vary from drug to drug. There's another thing called Good RX. Has anybody heard of that? That is not insurance, but it's a good thing. You can if anybody has a smartphone or computer, you can go on your Good RX, you can look up your medicines and it'll tell you the nearest pharmacy to go to buy it. In some cases, if that drug is cheaper through the Good RX than, in my case, Humana, all day long, buy it through the Good RX, especially if it's those more expensive. When you buy it outside of the insurance, because the insurance is not going to let you do the Humana and the Good RX. That's double dipping. You can't do both. It's one or the other. But if it's cheaper on the Good RX, it makes sense all day to buy it that way. And it keeps that out of the donut hole coverage gap pot of money that's building as we go along. Does that make sense? Sort of, kind of? Another thing for my folks that are taking those more expensive, GoodRx is a really good tool that it will tell you how to get in touch with the pharma companies, the pharmaceuticals, the Bayer, the Roche, the Pfizer's, that you're taking this super expensive medicine. It's expensive on GoodRx. It's expensive on the insurance. Call or write that pharmaceutical company. I'm taking your medicine for yada, yada reasons. It's a financial hardship for me. Do you have any assistance you can help me with? They have it for folks that have Medicare insurance. They have it for folks that have no insurance. There's government or special grants out there. So you have to be an advocate for yourself to definitely seek these out. Last but not least, asking your doctor for samples. Sometimes it's hard to get, but sometimes the pharmaceutical companies or drug reps have left samples with the doctor. Those are always great because those are no cost. Sometimes there's discount cards. It's not the GoodRx, but it's a discount card from Pfizer, Roche that said you can go get your prescription filled 5 times, and I'm gonna make up a number, at $10 with this card. You're only going to get so many fills off the card. Once you've done it, it's gone. You've either got to get the doctor to give you another one or get it from the pharmaceutical company. But again, that's another means of trying to save some money on those super expensive meds, and it keeps that out of that donut hole coverage gap pot. So that's definitely things to think about. Medicare options. So again, we talked about original Medicare. That's Part A, hospital. You've got inpatient hospital costs. Part B is going to be doctor outpatient. Outpatient, like with the case of my kidney stone, I went into Lexington Hospital, had my stone blasted out. I discharged same day. That's outpatient surgery. That has its own set of costs versus inpatient, where I'm actually in the hospital staying overnight. Medicare Advantage plans, remember that's the A plus B plus D equals C. That includes Medicare Part A hospital, Part B doctors, must continue to pay the Part B premium, whether you physically are paying it yourself or you're getting that extra help such as Medicaid. Usually includes the extra benefits. In the case of me, that's some vision, some dental, transportation, silver sneakers. May also include the prescription drug coverage. We also have the other option where you can do original Medicare by itself. You just have A and B, and then you protect yourself by buying the prescription drugs standalone Part D. And then you have Medicare, original Medicare Plus. That is original Medicare, buying the supplement on top, and then the drug plan on top. Only thing I would precaution you with Medicare by itself, with nothing else, is there's no maximum out of pocket. So 20% just keeps going and going and going and going. Whereas on a supplement, you're protected in the cost because you're buying that upfront monthly premium to capture cost on top of Medicare. When you're an Advantage plan, if anybody has one of those, you'll see on your plans, they have, it's a slang term, MOOP, MOOP. What that means is maximum out of pocket. So throughout the year, the copays that you might be responsible for at the doctor, the specialist, the hospital, as those copays are adding up, they go towards a maximum or a ceiling in cost that if, Lord forbid, you had a blow up year where you were in and out of the hospital, doctor's appointments, and you had $5 at this doctor, 30 at the specialist, $298 for one night in the hospital. If all that throughout the year ever reached, in my case, one of my plans is $5,900. If your costs ever reached total for the year, lots of hospital, lots of doctor, labs, ambulance, if all that amounted to $5,900, you've reached your ceiling in cost. Your cost cuts off, the insurance company pays the rest of your medical for that year. January 1, the reset button goes to 0. It starts all over for the next year. Medicare doesn't have that safety net. So 20% keeps going and going and going. So that's probably my concern of safety there. Enrolling in Medicare, if you're already enrolled in a Medicare member and want to enroll in a Medicare Advantage plan or change or renew your Medicare Advantage, remember now's the time. That open enrollment, physical applications can be made October 15th to December 7th. That's your AEP. Other election periods, we talked about the SCP. That's that special election period. You've moved, you might have extra help, you might have one of the chronic conditions. Something's going on to warrant raising that window to make a change outside of the October 1 to December 7th. Then the OEP, that's something new Medicare started about 3 years ago to allow you guys, because it used to be December 7th happened and you were done. You couldn't do anything again until next year. So Medicare recognized, hey, we might need to give them an opportunity to make a change. Maybe they did something and it's not working for them. So you got that January 1 to March 31st period to make that next optional change if you need to. Important things to consider about choosing a plan: money, cost. What is it going to cost me? Remember, we got to pay the $148.50. That's a given. Medicare's taking, or Social Security's taking that out, whether you're paying it or Medicaid's paying it. So is it going to cost me anything above and beyond that? I said I had some plans that are zero. I have some with premiums. Benefits. Is this giving me the benefit I need? I want dental. I want transportation. I want to go to the doctor I want to go to. Convenience. Is it giving you the ability to do all the things you need to? The supplements, remember, convenience of going wherever you want to go. You don't have to second guess, who's my doctor? Are they in my network? I'm going to be in California for 5 months out of the year, and I'm going to be in South Carolina the other 7. Is this going to meet my need? And providers, making sure you're scrubbing that doctor list to make sure those doctors are in the network. That's the worst, that you've gone somewhere and they're like, that's a good plan, but guess what? We don't take it. So you've done all that due diligence to get a good plan, but it's not going to work for you. So making sure you or the agent you're speaking with is checking all that for you. That's part of our job. Helpful resources. I think everybody just recently got the 2022 Medicare and You book, the big, in the back of that book, they listed off by counties and plans. So you should be able to reference in the back of there, the plans. There's also SHIP, that's the state health insurance program. That offers you ability to see about any extra health type things. So really that's my plan or my presentation for everybody today. I thank y'all for your attentive